Hey guys, Dr. Heimlich here. And what I want to do today is talk about taking your medications the way they're prescribed. It's really a bad idea to start veering away from taking any type of medication from the way it's prescribed. Thyroid medications included. Good case in point, I just had a lady brought in her mother who was having low thyroid symptoms. You know, she was having the fatigue, her hair was falling out, she was having night sweats, um, insomnia, you know all the symptoms I'm talking about. Well, she had all those going on, and the lady who brought in her daughter was on Synthroid, and the mother she was on Thyroid, and the mother figured, hey, since my daughter's symptoms aren't quite as bad as mine, maybe I'll start doing some of her medication with my medication, and I'll start feeling a little bit better. Well, that wasn't the way to go. It seems obvious, but it wasn't to her at the time. Then she took it, and nothing really got better, kind of get a little worse. So she said, you know what, I'm just going to start taking Synthroid instead of my Thyroid because maybe that's what I need to do. And then she started to ravel even more from that. So the thing to remember is don't do that. I mean, if you're still having symptoms and you're taking a medication for those symptoms and it's not taking care of it, especially or specifically with the thyroid type of thing, well then guess what? It may not just be a function of getting the right medication to take care of your symptoms. Otherwise, you're just going to be, spinning around like a dog chasing its tail. What you need to do is maybe take a different type of look at it and see, hey, do I have Hashimoto's thyroiditis? Because if you're living in the United States, there's a good 85-95% chance if you have hypothyroid symptoms and you've been diagnosed with that, that you have that. And what is that? That's an autoimmune condition. It's an autoimmune condition is where the body is attacking itself. Okay, so the body attacks itself. Doesn't sound great. It likes to go after the thyroid whenever you have things like Hashimoto's thyroiditis. The problem with this is that it's not a thyroid problem, and the meditation that you're taking does absolutely nothing whatsoever to help out with that. It doesn't take care of those symptomatology because what's happening is you have these cytokines, these things that are floating around in the body that are blocking thyroid receptor site cells. So you got these thyroid receptor site cells, and what happens is the hormone's supposed to come in here and bind. Well, if you have something blocking this, blocking it here, then this can't do what it needs to do. And that's what happens with Hashimoto's thyroiditis. So what we need to do is if you're having problems with the medication, first talk to your doctor. See if they can get the dosage under control. If they can't, then maybe you need to start looking at possibly managing your thyroid in a different way. Talk to a doctor that knows about these things that we've just talked about. But the big take home here is absolutely don't regulate your medication around based on how you feel. Talk with your prescribing physician. Okay? And if you don't get things worked out, find someone who understands what we talked about. Dr. Heimlich, have a great day.